This is the research on asthma by Christina Goodwin. What is asthma? So asthma is a chronic lung disease that inflames and makes the airways narrow, which causes a person to have a hard time to breathe and pass air through the lungs. Usually when you see someone that has asthma, they'll have a really hard time breathing, and you can see like their whole chest moving and their stomach moving as well. It's usually a rapid breathing that goes with it too. The symptoms of asthma is shortness of breath, chest tightness or pain in the chest, trouble sleeping caused by breathing, coughing, or wheezing, a whistling or wheezing sound when exhaling with the breath. Coughing or wheezing attacks are worsened by a respiratory virus, cold, or flu. So with these symptoms, it's not like it happens just a one-time thing. With asthma, it can happen multiple times throughout the lifespan of the person, or it can have many episodes where the person will experience this quite often, and usually it's diagnosed by a doctor as well. So this picture is just showing where the narrowing happens, and in the bronchial it has the mucus in there as well. So the bottom part down here shows nothing, where there's no mucus or anything in there, and the person would be able to breathe just fine. This one has mucus in there, and then this person is showing where the trachea and the lung are located. So there are different types of asthma. There's exercise-induced asthma. This is where the person has trouble breathing during exercise. That may require medication, and it causes trouble with breathing when they are doing any exercising, sports, anything like that. Occupational asthma is where chemical fumes, gas, dust may trigger a flare-up with asthma, or like an episode like I was talking earlier, where it would have the symptoms like tightness of chest, shortness of breath, anything like that. Sometimes they call those flare-ups as well. The allergy-induced asthma is a particular allergen that causes a flare-up with asthma, including pet dander, cockroaches, and pollen. So these are some of the different types of asthma that someone may see or have. The risk factors of asthma: you can have a blood relative with asthma. You have another allergic reaction, such as atopic dermatitis or allergic rhinitis. Being a smoker, exposure to secondhand smoke, exposure to exhaust fumes, chemicals used in farming, hairdressing, and manufacturing, and being overweight. So some of these are the risk factors that can happen when you have asthma. So what happens in your body during an asthma attack? There are three primary changes that take place in your body. So you get an increased mucus in the airway, which it becomes irritated and inflamed. The cells produce more mucus when this happens, and once your cells produce more mucus, it becomes harder to breathe in the bronchi, and then that's when you kind of start getting the symptoms that we were talking about earlier, with the tightness of chest and all that. The mucus is usually thick, and it can clog the airway, which also makes it hard to breathe. The second one is inflammation and swelling. The airway of your lungs swells in response to whatever is causing the asthma attack. And the third one is muscle tightening. The airway becomes smaller, which it makes it harder for the person to breathe. One thing too with asthma attacks is my daughter, her muscles tighten a lot and her airway becomes smaller, but she doesn't wheeze. So when we go in, they usually say that she's not having an asthma attack when she is. She doesn't have much wheezing, so the doctor can't hear anything. But when they go down to the lower part of her lungs, they can hear usually some crackling sounds. And she's been diagnosed with asthma, but her asthma isn't classified under the normal. So there's always different types of asthma that can happen. The etiology of asthma. The etiology is unknown but is the most common chronic condition affecting both children and adults. And like I was saying earlier, my daughter was diagnosed at an early age. She was diagnosed around 3 and 4, and she was put on medications. Now she's doing a little better, but she still has the medications as needed. My son also has asthma, and he was diagnosed at a younger age. We have to neb him. He has asthma-induced, um, exercise-induced asthma, as well as just if he gets a cold, if he gets around other allergens, it flares it up. He has to take nebs. He's on steroids. He hasn't had any hospitalizations yet. My daughter has had hospitalizations with her asthma when it gets bad. So it can happen to both children and adults. The triggers of asthma are airborne allergens, pollen, animal danger, mold, cockroaches, and dust mites, respiratory infections, physical activity, cold air, air pollutions and irritants, medications, beta blockers, aspirin, ibuprofen, naproxen, strong emotions and stress, sulfites, preservatives added to food, beverages, dried fruit, processed potatoes, wine, and beer. And these are just some of the triggers that can happen with asthma. There's a wide variety, and different people have different triggers when it comes to that. Here is just some pictures of the pollen, dust mites, and mold, and then some medications that can be affected or can affect asthma as well. So the cells affected by asthma, the epithelial cells, these are the first line of defense against inhaled pathogens and particles. It initiates the airway inflammation and produces the mucus. And when your airway gets inflamed and has mucus, it causes the airway to narrow, which has less room for you to breathe, which causes breathing problems. And that is this one. These are the epithelial cells. The smooth muscle cells are the cells they contract excessively to cause symptomatic airway narrowing, and which causes difficulty with breathing. And these are the smooth muscle cells over here. Diagnosing, a doctor will look over the medical and family histories. It's usually run down in families. With my daughter, her dad and grandma have it, and with my son, it's on his dad's side as well. They do physical exam and test results. The doctor will classify your asthma as intermittent, mild, moderate, or severe, and the treatment will depend on the severity of the asthma diagnosis. Usually you can have an action plan, and you go by that, and then if you have any kids, the action plan is usually in place by the school, and they have a copy of it as well. You may need a specialist if you need extra special tests to help diagnose the asthma. You have a life-threatening asthma attack, you need more than one type of medication, or a higher dose that needs to be monitored. You're not able to control your asthma, and you're thinking about getting allergy treatments. My daughter had to be seen by a specialist for many, many years during the earlier part of her life. She had some really bad asthma attacks. Her asthma was classified as special, I guess, since she doesn't have the classic signs of it. She needed more than one type of medication. She was usually on a prednisone orally. She was allergic to the IV medication. She was on different types of the neb solutions, and then she was also on a high dose of Advair as well. So we had a really hard time of controlling her asthma. My son isn't as difficult, but it gets a little difficult with the sports that he's in. So, with the physical exams, the doctor will listen to your breathing. They'll look for signs of wheezing, a runny nose, swollen nasal passages, and allergic skin conditions. Not all these signs may be present at the time of the checkup, but like any physical checkup that you have with a doctor, they always ask questions. If you have any signs or symptoms that these are happening, you just let them know. They usually ask how frequently they're happening, how often they're happening, how long they're lasting, and the severity of them. The diagnostic test is the lung function test. It's a spirometer, and it checks to see how your lungs are working and how much air you can breathe in and out. And this test can usually measure how fast you can blow air out. So it's kind of like with this test, it's like blowing a balloon. You just kind of blow, 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 and then this little thing will kind of start rising as the number, and then you go and you blow as much as you can out, and then you breathe in, and that's pretty much what the lung function test is. They'll do an allergy test that usually is when they poke your skin, and then they see what you're allergic to. Test to measure how sensitive your airways are. The test is called the bronchoprovectin test, and then sometimes they'll do a chest x-ray or an EKG to see the status of how your lungs are looking, or if pneumonia is involved as well. What the doctor looks for in children when diagnosing, they check to see if one or both parents have asthma. The child has signs of allergies, including a skin condition. The child has allergic reactions to pollen or other airborne allergens. The child wheezes when they don't have a cold or any other type of infection. And these are just some of the things that the doctor looks for. There's a wide variety. Like I was saying, my daughter has different symptoms than a normal child would, and my son wheezes, but not as bad. The control of asthma. The asthma is a long-term disease that has no cure. The goal is for the asthma to be controlled. For good asthma control, what you're looking for is to prevent coughing or shortness of breath, to reduce the need of an inhaler, to help maintain good lung function. The person should be able to maintain normal activity level and sleep throughout the night. You prevent asthma attacks that may result in ER and hospital stays. The reason why they usually say so much about the night is sometimes the flare-ups happen more at night and you're not able to sleep through the night, or there's a lot of coughing, and that usually is associated with asthma and not being able to control it. So with controlled asthma, the things that you'll see with good asthma, or I guess you can call it, is symptoms that last no more than 2 days a week. You do not get waken up from sleep more than 2 nights a month. You can do all your normal activities without any shortness of breath. You do not need to take a quick relief medication more than twice a week. Not more than one asthma attack where oral meds are needed. The peak flow does not drop below 80% of your best number. Peak flow is just a piece of equipment that you use to see how good you're breathing. You just kind of take a deep breath in, breathe out, and then a number shoots up and it tells you how good the airway is. To prevent the symptoms, you should follow the action plan that was put in place by your doctor. Use medications and take them as prescribed by your doctor. Try to avoid the triggers that flare up the asthma attacks. Keep track of your asthma symptoms and level of control, and get regular checkups. This is what is called the peak flow. When you breathe into it, it shoots up. The action plan it describes the daily treatments and includes the medications that should be taken and when to take them. This plan will also describe what to do when you start having flare-ups and when to contact your doctor. Worsening asthma is symptoms start to occur more frequently. You start to lose sleep frequently. Symptoms get more severe, limiting your normal activities. The peak flow number is lower. You have to use your inhaler more, and you have to get immediate assistance or go to the hospital. And these are some of the resources that I used to find out the information for my PowerPoint today. Like I was saying, with the asthma, every person is different. It can affect children and adults. Children are a little more harder to diagnose at times, but every case is different. And with the doctor, they have to go case by case, patient by patient. It's not all just, they can't just go off a checklist. It takes sometimes a while to get diagnosed, but hope you enjoyed my PowerPoint, and thank you for listening.